As we age, it's natural to become more concerned about our health. After all, the body changes, the risks increase, and regular checkups can help catch problems early. But here's the truth no one talks about: not every test is necessary after 70. In fact, some can do more harm than good. Doctors don't always agree, and guidelines change. But many experts now say certain screenings and checkups past a certain age may lead to more problems than solutions. False alarms, anxiety, unnecessary procedures, even serious complications. So in this video, we'll explore 5 medical tests and checkups seniors over 70 should reconsider, especially if you're healthy, symptom-free, and just following routine. Let's begin with number 1. 1. Colon cancer screenings, colonoscopy. For decades, colonoscopies have been a gold standard in cancer detection. They're useful and often life-saving, up to a point. But after age 70, or especially 75, they might be doing more harm than good. Why? Because colonoscopies are not risk-free. They require heavy sedation, bowel prep, and the procedure itself can cause bleeding or even bowel perforation in older adults. Plus, if a suspicious polyp is found, you might be pushed into surgery or further treatment, which carries higher risks with age. The U.S. Preventive Services Task Force advises routine colorectal cancer screening up to age 75. After that, it's a personal choice, especially if past screenings were clear. If you're over 70 and have no symptoms, no family history, and have had normal results before, you might not need another colonoscopy. And even worse, many seniors are still being scheduled for routine colonoscopies every few years, even when they no longer benefit. Talk to your doctor, weigh the risks, and remember, more testing doesn't always mean better health. 2. Prostate cancer screening, PSA test. This one is especially controversial. The PSA blood test checks for prostate-specific antigen, a protein linked to prostate cancer. But here's the issue: prostate cancer often grows very slowly. Many men die with it, not from it. So what's the danger? False positives. Elevated PSA levels can lead to unnecessary biopsies, which are invasive, uncomfortable, and sometimes dangerous. Worse, they often lead to aggressive treatments like surgery or radiation, treatments that carry significant side effects, such as incontinence or impotence. Most guidelines now recommend against routine PSA testing in men over 70, especially if they're not showing symptoms. The American Urological Association, for instance, says men over 70 should generally avoid PSA screening unless there are specific reasons to do it. So if you're feeling fine, not having urinary symptoms, and especially if you're over 70, talk to your doctor before saying yes to a PSA test. The truth is, you may be chasing a disease that might never harm you. 4. Full body scans and routine imaging, just to be safe. Many seniors fall into the trap of believing that more testing equals better health. So they agree to full-body MRIs, CT scans, or X-rays, even when they have no symptoms. These scans are often marketed as peace-of-mind checks. But they can do the opposite. Here's why. Full-body scans often reveal incidental findings, tiny abnormalities that look suspicious but are completely harmless. Doctors call them incidentalomas. But once they're found, you're often pushed into biopsies, follow-up scans, and even surgery. All of this can lead to a cascade of interventions, none of which improve your health, and some of which can cause real harm. Moreover, some scans expose you to radiation, which increases your long-term cancer risk. And in older adults, the risks are amplified because your body is more vulnerable to the side effects of unnecessary treatments. Unless you're experiencing symptoms, have a strong family history, or your doctor has a specific concern, skip the full-body scans. Trust your body, and don't go looking for problems that aren't there. 5. Routine bone density tests, DEXA scans, without risk factors. Osteoporosis is a real concern for seniors. Fragile bones, hip fractures, and falls can change lives. But here's something you might not know: routine bone density scans after 70 may not be useful for everyone. If you're a woman who had normal results in your 60s, and you're not showing signs of bone loss or weakness, repeating the DEXA scan every few years may not be necessary. The same goes for men, where routine DEXA screening is even more questionable. Unless you have known risk factors, like long-term steroid use, smoking history, or very low body weight, the test might not offer any real benefit. And here's the problem: once a scan shows mild bone thinning, many seniors are prescribed medications like bisphosphonates. These drugs can have serious side effects, jaw problems, stomach issues, and even rare bone fractures. Sometimes, the cure can be worse than the condition. If you've already been diagnosed with osteoporosis and your treatment plan is working, that's different. But if you're otherwise healthy and mobile, ask whether another scan is truly necessary. Not every bone needs scanning. The bigger picture: when tests become trouble. As we get older, the value of many medical tests decreases, while the potential for harm increases. That's the truth many doctors won't say out loud. Why? Because medicine tends to focus on action. Doing something feels better than doing nothing. But in older adults, especially those over 70 or 75, watchful waiting is often safer and smarter. Overtesting leads to overtreatment. Overtreatment leads to complications. Complications lead to hospital stays, surgeries, and a cascade that can affect your independence and quality of life. So how do you decide which tests are worth doing? Talk to a doctor who respects your age, your values, and your goals. Ask about the risks and benefits. Don't be afraid to say, "What happens if I don't take this test?" Or even better, "What would you do if you were in my shoes?" Sometimes the wisest health decision after 70 is knowing when to say no. Final thoughts: aging with intention. Aging isn't just about living longer, it's about living better. That means protecting your energy, your peace of mind, and your body from unnecessary harm. Medical technology is powerful. But it's not always precise. And for seniors, balance is everything. Some tests save lives. Others simply disrupt them. So be cautious. Ask questions. And remember that real healthcare is not just about finding disease, but preserving the life you already love. If this video helped you rethink any of your checkups or raised questions you'd like to ask your doctor, share it with someone you care about. Aging well isn't just possible, it's powerful. Stay strong, stay wise, and above all, stay in control of your health.